Good morning, dears. We had completed the common symptom of neck tumors, and today we are discussing about when it affects the GIT. NET tumors usually affects the GIT, anywhere in GIT, but particularly in stomach and small intestine. Once again, I am saying it can affect anywhere. And let us see, when the neck tumors affects the colon as a whole, the symptom of our patient may be as number 1, diarrhea without blood, and there may be very severe abdominal cramping pain. Abdominal cramping. And our patient may having other GIT symptoms like heartburn or retching or nausea and vomiting, then urging. All these symptoms may be misdiagnosed as or badly perceived as a case of gastritis or a case of peptic ulcer disorders or a case of ulcerative colitis or a case of Crohn's disease, something like that. So the symptoms may be, or the symptoms can be a case of PUD or a case of irritable bowel syndrome or a case of inflammatory bowel disorder, something like that. And when the colon is affected by, along with the neck tumors, and when it superadded by infections, particularly by the gut infections, then our patient may have symptom of fever or pyrexia. The symptoms of our gelsemium, rustox, bryonia, eupatorium, something like that. Sore, lame, bruised feeling all through the body as if beaten. So fever with abdominal pain, with diarrhea, with blood or without blood, with cramping, with urgency. It can also be a case of appendicitis. So the symptoms are not much specific, and along with all these chronic symptoms or the persistent symptoms, automatically you can see the symptoms of malabsorptive disorders, MADI or malabsorptive syndrome. So the symptoms may be of defective intraluminal digestion, defective intraluminal absorption, defective intraluminal transportation, and defective intraluminal uptake and utilization of the absorbed nutrients. The expression of the symptoms may be, or the symptoms are well explained in our previous chapters of acute and chronic pancreatitis. So please go through the symptoms of malabsorptive disorders. Because of all these issues, your patient naturally or automatically become very weak, fatigue, loss of weight, then emaciation, and one of the characteristic symptom of the neck tumors are there is very severe urgency in bowel movements. You know the urgency, especially with a urinary problem, particularly in prostatic cancer or a BPH, something like that. Here, patient cannot control. Patient loses his control over the rectal or anal sphincters, and whenever he is having a sense of defecation, he must do it. That means he cannot control. So there is fatigability, psychologically very depressed and very anxious, very fearful. Physically our patient is very weak and very lean. Unexplained weight loss with the symptoms of our aloes, podophyllum, sulfur, bryonia, nexamica, arsenica, etc. So these are the common symptoms of particularly with the colon, and we have to study the pancreatic tumors with a particular important with particular type of cell involvement. That I think that can be studied in next class. Thank you for watching. Thank you.